Hello, everybody. Hello. Welcome to another episode of UNoverwhelmed Emotional Fitness. In this channel, you're going to find different resources and reflections about how to be unoverwhelmed with a challenge, especially if your child is autistic. So today we have a very important topic. We are going to talk about speech therapy. We have a very important, very dear to my heart. She is Georgina Lynch. Georgina Lynch is going to tell us about speech therapy. She's going to answer questions that maybe we didn't even know that we should be asking. For example, she's going to tell us about what is a speech pathologist, what is the importance of a speech therapy. Should we do it? Should we not? Maybe we don't even know when to start. She's going to tell us about that. She's going to tell us about the eligibility and when is good time to start. And of course, maybe the expectations and the goals on the speech therapy. So we're also going to be talking about the referral process and the risks of the delay. What can happen if we don't take action? And of course, very important, the parent involvement. How should we get involved as parents? Remember that speech therapy is not only for children with autism. So she's also going to talk about that. So who is Georgina Lynch, you may ask? Well, I'm going to read a little bit about Georgina Lynch, and you can find more information on our page on courses.com, but I'm going to read a little bit here so you can see who Georgina Lynch is. So she's a renowned researcher, clinician, and an advocate in the field of autism and neurodevelopmental disorders. She holds an interdisciplinary PhD in neuroscience and psychology. She's also a licensed speech-language pathologist. She's nationally certified by American Speech Language Hearing Association. With over 20 years of experience, Dr. Lynch has dedicated her career to assessing and treating individuals with Autism Spectrum Disorder, SD, and other neurodevelopmental conditions. So please, if you want to know more information about her, you can go to their page and courses that we're going to leave the link at the end in the description. And also in the link, you're going to find some resources that Dr. Lynch is going to share for us. So please welcome Dr. Lynch. And please remember, give a like and share the episode because it's going to be very interesting for you. Thank you. Georgina, good morning. How are you?
I'm doing well. Thank you, Alvia. I'm delighted to be here with you today.
Thank you so much for accepting this invitation. A lot of people are very interested in talking about this speech therapy, and who best than you? Before I say anything, I would like to mention that the kind of person you are. Not only are you a great speech pathologist and your amazing background and how much you have accomplished in only 20 years experience, right?
About that, yes.
Only in 20 years experience, how much you have scaled. I'm not going to mention the super long accomplishments, but we're very proud of you. And I do want to publicly mention a great appreciation that when I went to Washington, how you practically just paved our way and how you made it easier for me and my son, because it's always a difficult road. But if it hadn't been for you and how you even sat with me throughout the process, that made a big difference. So really, thank you. And of course, now today, I would like to share this to the world because I would be too selfish if I keep it to myself. Do you want to say something before we start, do you feel?
Sure. I'll just chime in briefly. As we talk about speech language pathology today, we're going to talk about assessment and intervention and how that can be a critical part to a child with autism, their intervention planning, and empower parents to understand how the role of the speech pathologist can really help them as a member of their team. And second, I'm just pleased to be here today. I wear multiple hats. I am a researcher. I have conducted experimental research in autism for a few years as well, but I'm also clinically trained. And so we'll talk about that a little bit and how your clinical training informs the work that you also do as a researcher. And so my hat today is truly as a clinician to talk with parents about the value of speech therapy.
Right. So let's start with your super long name. So Georgina Lynch, PhD, CCC, CLP. What does that mean?
So all of these acronyms, what does that mean? So my PhD is an interdisciplinary PhD in neuroscience and psychology, and that's truly the traditional sense of a doctorate in terms of research and conducting studies and publications, and that's what I do at that level. And I went back for a PhD in 2014 after having been a speech language pathologist since 1999. And so the SLP CCC part is the clinical training. And so I'm clinically trained at the master's level, and SLP means speech language pathology.
Mm.
And so speech is the articulation or the actual speech sounds that we make. But what people don't understand is there's also language, and language is different than just speech. Language is how we put our ideas, thoughts, and our cognitive skills to work in order to communicate. And so speech language pathologist means the study of speech and language. That's the SLP part. The CC stands for Certificate of Clinical Competence. And anytime you work with a speech pathologist, you want to look for those 3 Cs, as we call it, at the end of their title. That is recognized by the American Speech Language Hearing Association. And the Cs means that you have taken a national board exam around your clinical training to demonstrate your competency, and that you also have put in a fellowship and the training at the graduate level around implementing and practicing as a speech pathologist. So when you hear the term speech therapist or speech pathologist, when they have the C designation, they're essentially the same thing. In hospital settings, just for the sake of time often, they're referred often as a speech therapist, much like the other therapists in the organization.
That is
So
very interesting.
it's kind of a big, long name for something that really we do in therapy. And so speech therapist is often used in place of all of that.
I thought they were different, so thank you for that clarification, because I always thought like the pathologist had to study more, so it's practically the same. Thank you
It
very
is,
much.
yes.
So also, just because people speak doesn't mean that they have actually acquired the speech, right?
Language. So you need the motoric ability to make speech sounds, but you also need the brain function and the neurologic processes to connect your ideas and form sentences and make conversation and really communicate in that way. So we look at it as 2 major domains when we're assessing children for speech and for language.
Oh, very interesting. Thank you. So, well, our main focus obviously is a lot of people need speech therapy, not only for my main concern is ASD, which is Autism Spectrum Disorder, but it's a whole rainbow of different people who would actually need it. But focusing on ASD, can you explain why speech therapy is crucial to children with autism?
Absolutely. So what we know about autism spectrum disorder is that when that brain is developing, it is often underconnected. And what that means is that certain regions of the brain aren't communicating as effectively with other regions of the brain. And in order to develop speech and language, we need all of those regions effectively and efficiently transmitting signals to be able to speak and understand what people are saying to you. And so what we know is that 90% of speech pathologists work with autism. And in an outpatient pediatric clinic, at least 25 to 30% of your caseload will be autism spectrum disorder.
Wow.
In 90% of cases, physicians are recommending speech therapy because what happens is we have evidence-based practices that are very unique to helping change the outcome for autism because of the way the brain is developing. But it's highly plastic is the term. There's neuroplasticity where the brain is responding and changing constantly during a period of their early development. That in autism spectrum disorder, we really have to treat it very differently than we do for a child who's just a delayed talker, or maybe there's a mild hearing loss or something like that. We're going to treat that very different than we do with autism. They have a critical window for this.
Wow, it's interesting. You mentioned 90% of the cases. So what is the other 10%?
90% of speech pathologists serve autism. 25 to 30% of their cases in a clinic is autism.
But
in the school system, even higher, 70% of their case can be autism.
then, sorry, I'm sorry to interrupt, but just to clarify. So once the child is diagnosed with autism, the most important and crucial thing is that they must attend speech therapy. Agree?
That is incredibly helpful. Yes, that would be one of your number one therapies that you are seeking when your child has been diagnosed with autism. And when we think about speech and language, we think about acquiring your individual speech sounds to say words. Language is being able to put two words together. Help me. I want more. All of these ways we build the building blocks for speech and language, which is communication. And so even if a child has some words, but they're not communicating effectively, a speech language pathologist will support that and provide intervention around that. And if they're nonverbal, we may do the same, but we do it very differently.
Wow, thank you. So what about the eligibility? Who should consider speech therapy? And are there specific signs or milestones that indicate the need of therapy?
Yes. So what you will see is as you're taking your child to their pediatrician, and we have well child checks, which happen annually. Typically, when they're very young, you're going in more frequently, but then it starts to be a yearly visit to your pediatrician where you talk about development. And what you will find is that sometimes physicians will wait and say, well, maybe your child isn't talking because they're a late talker or they're shy or some other reason. And so we know that children develop speech and language and those individual speech sounds. That starts at age 13 months to about 18 to 24 months at the very latest. And so if your child at their well child exam at 13 months is not pointing, not using gesture, not smiling, not engaging with you, and you've got this question about how they're doing, have that discussion with your physician. That is not too early to make a recommendation for speech therapy. We can work with kids as young as 12 to 13 months, and we love to get kids at that age. Moreover, what we see is you come back, second well child exam, now they're 2 years old, still not talking. Then we really have a significant red flag that something more is going on. We don't really want kids to be waiting a year beyond a milestone of typical speech acquisition before we make that referral. So that's how children are eligible for speech therapy, is your pediatrician does make that referral for you. And you can ask for that referral at those well child checks or routine visits.
Now, that's very interesting because I remember when I was noticing stuff with my son, he wasn't speaking, he was pointing things, he would take me with the finger. But I thought that I was raising him to be bilingual. I was teaching him English at home. So then I had two girls as reference. And then I studied that normally boys speak, they have a speech delay more often than girls. So I thought, well, it's okay. That's because he's bilingual and he's going to take a longer time. And I remember when I went to the school and they said, well, he's not paying attention. Well, that's okay. It's because he's bilingual. But his English teacher here doesn't pay attention to the English teacher either. So obviously it was a big red flag there. But so it's very important that regardless, they should be communicating already by 13 months.
That's right. And those signs that you're looking for, those things that you were asking about, which is you were comparing to your other children who were following that trajectory. And when we see a bilingual situation, we always ask the parent first, in the primary language, are you also seeing this issue?
Mhm.
And if that's a yes, then that is definitely not just a bilingual language acquisition issue, but a true organic speech delay or language delay in your primary language.
Right.
So we do know that other red flags that you might look for that may warrant a need for speech therapy is lack of babbling. Regardless of your primary language, children babble. They play with their lips, they play with speech sounds, they repeat speech sounds over and over as part of the typical speech acquisition process. So, lack of babbling, lack of coming to you and engaging with you and wanting to show you things. Even if we're unable to speak, we are still making those overtures. And then lack of smiling or turn taking with familiar caregivers. If you're really having to force yourself to get in there, or they're using you as a tool, as you said, your son would grab your hand. You were a means to an end as opposed to wanting to really share this experience. Those are the things that we're looking for early red flags for autism. And so a speech pathologist can help parse out the difference between a delayed speech and language scenario that isn't autism, that's different from more of those features of autism that prevent you from acquiring speech and language.
Right, and of course, we have all the opinions from other people who always know better. Says, no, it's because you are guessing you're reading his mind, and you don't make him speak. You gotta force him more. It is very tiring. But I do remember that Rafael was just making sounds, blah, 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 blah. So that was a big red flag. That, of course, my ignorance, right? I just thought that he was just delayed. So that's so. Thank you so much. So in that timing, so should verbal and nonverbal children apply for speech regardless, both of them?
If we are
When do
looking
you
at
know if they're verbal or nonverbal? And it should both of them apply?
So, if you're looking at a potential diagnosis of autism and your doctor suspects autism, or maybe has even made that diagnosis of autism, if a child is verbal, they're still going to benefit from speech language pathology, because speech language pathologists work on teaching children to initiate and use the language that they have in a functional way. So, even though you have a verbal child, you may have a child who's using echolalia or repeating the words that they've heard, but not using the verbal speech they have effectively for learning and communication. And so, although which is a hallmark for many kids of autism because they have restricted repeated behaviors. That's the definition of one part of the criteria for autism. This can happen in their verbal speech where they're repeating immediately based on what you say. If you ask, would you like the ball? And they just say it right back to, would you like the ball? As opposed to saying, yes, I'd like the ball, and interacting that way. It's also delayed echolalia, which is more like scripting. And that's where if we've seen a cartoon that we like, Thomas the Train or VeggieTales or something like this, and out of the blue, they may use some of the verbiage that they've heard in those shows. And for them, sometimes that conveys a sense of meaning. That's their way of communicating. Something happy about that show tells you they're happy in that moment, but they can't use language that we're using effectively in that way. So again, verbal kids benefit from speech therapy. We also have a real need for kids who are nonverbal to access a speech pathologist, because what happens is you have a critical window of time where verbal speech acquisition can happen. And if we don't provide that intervention early enough, we miss that opportunity to get that child verbal if they're going to become verbal. And there's ways that we do that. There are different evidence-based practices that facilitate it. We have also a specific intervention called AAC, Augmentative Alternative Communication. And with AAC, what we're doing is we're using the visual pathway with them. We're using pictures and objects, and we may use something that provides voice output in a handheld system like an iPad or some form of portable communication system. And what we know is that when children who are nonverbal with autism pair the pictures and the images and the icons with the words that they're hearing, they make that tighter association. So back again, when I said the brain's underconnected, it helps build that connection between this is the object, this is a picture of the object, and this is the word that I hear with that object, and it solidifies that. It also allows them, when they can't speak, to have a way to tell you, I'm sick, I'm hungry, I need help. and those kinds of things. So speech pathologists work with both, and they do it very differently, but the end result is increased communication, vocabulary, and engagement for learning and language acquisition.
Wow. Going back to the echolalia, you say the scripting part, I had to really pay attention to whatever my son was listening to because it could get you in trouble.
Exactly.
Or
Yeah,
he would go visit a place with relatives or friends, and he would come back saying some things like, where do you hear that? So we have to be very careful because then at school is like, what are you talking about? No, no.
that's
Now,
right.
I like the fact that you say, so just because they don't speak doesn't mean that they cannot communicate.
That's right.
Because whether they speak or not, they still have a voice.
That's right. And we can give them that voice by making sure that we give them the tools and the means to be able to do that with you. And what you'll find is that when we introduce AAC for a child who maybe has plateaued, we're not making a lot of progress with verbal speech, but we give them that tool, we find that the outbursts and the behaviors get managed better too, because we now have a way for our voice to be heard and to communicate to those around us who we are relying on to help us. So for families, this often can be used in tandem with teaching verbal speech in the early goings of this, or it can be used as the sole mode of communication, depending on what the child needs.
Right, because many of their tantrums and things is their frustration for not being able to communicate what they want, what they need, and how they feel. So
That's right.
it would help them lower their anxiety level. And also it will help us learn a way to communicate with a child, whether he speaks or not.
That's right. And one cautionary caveat that I like to put out there with respect to AAC is remembering that this is a neurodevelopmental neurological condition. This is something that, much like in adults who've had a stroke, we can't just expect that they can suddenly start talking without us working with the part of the brain that's impacted. With kids with autism, it's very similar. So I can't just give you that iPad or that AAC device and expect you're going to use it. We need to teach you the communicative behaviors of initiating a request, of seeking someone out. We still have to teach you those behaviors. And then also, depending on why you're not speaking, from a motoric perspective and brain development perspective, we need to address that as well. So for some kids with autism, it could be a combination of both a learning cognitive issue, but it also could be a motor planning issue and having the ability to speak. And so we want to give you the greatest opportunity to attempt to acquire verbal speech while concurrently maybe working with AAC. AAC is not by itself, it's just a tool. It is not going to make you start talking. We need to do some things to make that happen, but we certainly can use both together.
Wonderful. So what about the expectation? A lot of people say, well, how many sessions? If it could be quantified, you mean 10 sessions or when, how long? So what should people expect? Because obviously it's each individual is different and it's like, oh, so you mean in a year, my child's going to be speaking. So tell us about the expectations and the goals. What can parents realistically expect from speech therapy? And how do these expectations differ for verbal or nonverbal?
Yes, so very much the expectation, as you pointed out, Elvia, is it's individually based in terms of what we can expect from the outcome, depending on the age your child starts in speech therapy and what their presenting challenges are. The number one thing that you can expect is that you should be working in partnership with that speech pathologist together. So this is not something where you should just passively accept, here are the goals that we're going to work on with your child. It should be more of a collaboration. Here are the things that as a speech pathologist I see your child could benefit from the use of particular types of techniques and interventions. What are the goals you have for communication at home? What are the 10 words we want to work on and make sure that we're in tandem together doing this? So what happens is often parents will say to me, I've done my research or I've talked to some people and I should be doing XYZ therapy. And that's all. Everyone said, don't do the other stuff, just do this. Well, one thing that I think parents could really take home today in this conversation is understanding there is no one therapy that benefits autism and is the be all end all. There are many therapies. And what happens is, depending on your child's response to those different types of interventions, we may select another intervention when we're seeing gains in one area. And now we may turn things around and start introducing other interventions as those skills are coming along. So there is something called the National Standards Report that has reviewed over 700 studies of intervention outcomes for autism. And we know between their work and the work of the National Professional Development Center, who also looked at something similar, that there are about 27 evidence-based techniques that can be used, that the outcomes that are improved are adaptive skills, which are self-help, communication and language, and the behavioral changes. And so what will happen is your expectation should be that you may be making small gains weekly, but bigger gains over time. And so what happens is if we get a plateau for 6 months or longer where nothing has changed at all, we need to be, as parents, asking questions. What should we do differently? Is this intervention working? Not is speech therapy working, but the technique that you're using with them. So go ahead.
It was so interesting that I think that some people confuse the difference between therapy and treatment. So
Yes,
therapy is not a treatment. It's not like these antibiotics that you're going to take for this infection for 10 days, and after 10 days, you will be cured. So this is just therapy to increase their prognosis so that they can have a better, right, quality of life. So I think that's very important that you mentioned that, because it's not like 1, 2, 3 sessions of this or go here.
that's right.
So some therapies, yes, are more effective than others. And I do want to say this because there is no magic wand, because a lot of people
That's right.
have magic wand. So I don't think I don't know anyone having the Nobel Prize, and I will
Yeah,
repeat it over and over, that they have found the cure for autism, because a lot
that's
of people.
right. And so I would say that having worked with children with autism over the past 20 years or so, that in the late 90s, we really didn't know what are the best evidence-based practices, particularly for early intervention. There was a lot of work done at the time. In 2001, the National Research Council looked at early intervention models and the amount of time of therapy that needed to be in place. And at that time, people thought 40 hours a week of behavioral intervention was what was needed.
Wow.
And that was a different
Wait for
model.
that.
And that model has definitely gone by the wayside. And that was called the Lovas method. And it's not to say we don't use those behavioral techniques anymore. ABA therapists use those techniques. But what came out of that work with the National Research Council is, what are the qualitative elements that matter? Not the quantity so much as the elements that have to be in place. And those elements included parent education and teaching, presence of typical peers to model the language and the speech that we're looking for. So you're not just working one-on-one with an adult, you're also with other children. The use of visual supports, and that was a big one because that really wasn't part of the equation before, and how we tie that in to the therapy. And then frequent, intensive, repeated exposure, right? So that we have frequent opportunity to practice those skills. And so a lot of that has now been implemented in developmental preschools. There are a lot of interventions now that we have since been able to show those outcomes really do make a difference for a different profile of need. And so an example of not using one intervention, but maybe 2 or 3, and individualizing that, is the use of something like enhanced milieu teaching. It's called EMT, was out of the work of Ann Kaiser at Vanderbilt University. And what that is it's where we train the parent and we also tune into the child to elicit some initiations and come to us and really try to learn more language that way. Well, we know with EMT, it is most productive when kids come into that intervention with at least 10 verbal words. That has a really strong outcome if you come in with just a few verbal words first. So if I'm working with a child with autism who's completely nonverbal, they're not engaging with me, we're having a difficult time just getting them to join in with joint attention, then I might use something called pivotal response teaching, because that intervention focuses on teaching a child to tend to multiple cues during play and naturalistic interactions. And so I teach you to look toward my face by holding an object up to my face as I'm playing with you. And now I'm getting some eye contact that I would not otherwise get. And I might give a phonemic cue, which is just the first letter of a word, and hold up a favorite object. So if it's a train, I might say t, and then wait, and they say train, and I give it to them really quickly so they associate. Now I'm with you and we're playing together and doing this. When you get those behaviors in place, then we start bringing in those other interventions like EMT. We might also use PECs just initially to get that exchange going of communication. So the beauty of it, as I see it as a speech pathologist, is I have this child who has so many skills and so much need, but it's so unique to them. And I'm going to figure out with you what things you do really well and what things you really love. And I'm going to get in there and I'm going to adapt these different interventions. And it's almost like a dance with that child. I'm going to bring you along with me. And then we're going to build upon those skills as you respond to that intervention.
Wow. So in reality, you're just not, you have to also know behavior. It's very interesting. So what about the duration? What is the duration of the therapy? So normally, so how long should speech therapy typically last? And what factors might influence the duration of the therapy?
That's a great question, because when we think about the fact that this brain is developing and changing all the time, if we see you early, age 2 or 3, it's highly likely that a speech pathologist may continue to work with you into school age and late adolescence. And it used to be that we literally would pull the rug out from under the adolescent with autism because we'd say, well, you've had 8 years of therapy, there's nothing more to do here. When in fact, that's a new period of growth, developmentally, cognitively, and there's expectations that change in terms of the context. So in early intervention, a speech pathologist is teaching you those first words and getting you prepared so you can learn. And when you go to kindergarten, you will learn. School age, we may work on social pragmatic skills. That means just the skills of learning how to take turns, interact with peers, stay on topic in a conversation, play a game. We may work more on that kind of teaching and learning, where in adolescence, it may be those subtler skills, the soft skills. How do I prepare for the workplace, for those nuances of nonverbal communication? How do I read your body language? And so this may happen throughout development, that you're working on some form of speech therapy.
It just came to mind that the book that says, just when I was learning to be a caterpillar, I became a butterfly. I mean, so there's just like us in every stage of their life, they need to learn that communication part. So
That's right. And with autism, we know that when you teach a skill in a particular environment or context, they learn it for that environment and context. But they then have trouble generalizing to the new environment and context. So we simply have to then reteach some skills and introduce new skills depending on the demands of that context. And something that I've had the pleasure of being able to do is working with children when they're very young, and then knowing them when they're 19, 20 years old, 25 years old. And as I teach students of speech pathology at the university, I always say, back to your analogy of the caterpillar and the butterfly, we're planting the seed. When you have them at age 3 or 4, 2 or 3, you don't know who they're going to become. They have so much potential. And so you plant the seed, but you don't get to see that flower.
they need to learn how to be a butterfly still.
That's right. And
know
it's
where to go, how to hide from the rain.
That's right.
Just when
And
you
those
think
skills that you're building when they're only 3 or 4 years old are fundamental to future learning. And so that is a critical piece. And in neurology, they've been able to demonstrate that the trajectory of brain development in young people with autism, it's longer to develop. It's not that your IQ determines when you are 25 exactly what you will be done learning. That's your capacity. They have shown that brain development continues into the middle 30s for learning. And so that's a different trajectory than we think about. Which in typical development, we know frontal lobe is late to develop. Early
Mhm.
adulthood, it's still kicking in and we're making poor decisions and
Yeah,
things as
yeah. I don't know. I still know some people that are older that still make
that's right. And so,
I'm talking about chronological age or emotional age.
that's right. And in autism, we know that they continue that upward trajectory of development. And so we don't want people to give up, as we say. They still have things to benefit from and to learn from after high school. That is critical. And we see a lot of vocational programs being developed in the colleges around this too, to support that, because we believe that many people with autism can benefit from some of those community-based interventions in young adulthood that historically we hadn't thought of in the same way.
Wow, that is just so interesting because it's interesting that you mentioned before, and I want to make sure I emphasize this, that you said that sometimes we train the parents, right? You mentioned before. And that is important because instead of these 40 hours of therapy, if the therapy is doing something, but then at home nothing is reinforced, then we are not going to be able to actually, for him to actually apply where he needs it. Because bottom
That's
line,
right.
the child is going to, or the adult, or whomever is needing the therapy, they are going to need to communicate with their family. So that's where the skill needs to be taken. So it's very important that parents do get that training, right?
That's right. It's a critical piece, and a lot of our interventions have been, they've actually tested these models of when there's a parent education and training component versus not, and the outcomes. And we see children demonstrating significantly faster and more qualitative outcomes for their progress than when we don't have a parent training component as part of it. And as you said, you're with your child 24/7, you're with your child every single day, and we need to teach you those skills so that you can be doing that within the context of the routines that are done on a daily basis. And we talk a lot about how when you are able to come together as therapist and parent as a team, and we say, we're going to work on these three things over the next couple of weeks. Let's do that and let's talk about how it's going. One of the most rewarding things as a therapist is when we see that child come in and we can celebrate with you and say, I heard him say slide today. He was talking about the slide and rolling the ball down the little fake slide we had. And I knew it was because when you went to the park, you said that word with him over and over and put him on and pulled him down and said slide. These sound like really small celebrations. They are huge. And one of my favorite stories was a little girl that I worked with, and she was 3 years old, and she'd been in speech therapy for 2 years. I brought some graduate students out with me to work with her in a preschool for autism. And we watched her for the first day just to get to know what she was like. And she was nonverbal. She had a few words, but she would only count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And she bounced constantly in her chair. And in my head, I thought, this one's going to be a tough one. And because we needed to teach her to talk, and she had some potential for that. Well, we worked with her restricted interest, turning pages and counting, but naming all the pictures and taking turns with her and counting and doing actions with words. And when we were finally able to show that she had 20 expressive vocabulary words, and we met with mom, and she said, last night, grandpa put her to bed and she said, I love you. She said, oh my gosh, that was ill. Gives me chills because that's the connection we're trying to build. It's not about just naming things, it's about connecting with your parents and learning in your environment.
Thank you. Thank you so much for sharing that because bottom line, like I said, they need the voice. And as parents, it's very tiring because oftentimes many of the parents also have our own issues. Like myself, I have ADHD. So persistence and consistent is something that sometimes we don't have that structure.
That's
And
right.
these
Yeah.
children need structure. So something I have learned is that I had to be persistent on his therapy. So I had to learn to be consistent on my own so that
Yes.
he could
Yeah.
see it on for his own sake. So then I can only imagine the parents when they actually heard that it was just not a word, it was an emotion.
That's right.
That the girl was able to relate. Oh,
That's
wow. Yes. And that's what everything just pays off.
that's right. For all involved, right? And as we say, when the parent is at the center of the team, the pivotal piece around asking the right questions and determining the right priorities, because As a speech pathologist, you can say, well, she needs to learn nouns and verbs, or she'll never have a sentence to put together, right? That's a very technical kind of approach, as opposed to what are the contexts that this person is in every day with their family and other children, and how can we give them the language for those contexts so that it's meaningful? It's not just rote learning of verbal speech.
Yeah, yes. So obviously with insurance, and then we get the diagnosis, and then you don't need a diagnosis to be referred to a speech therapist, correct? So talk about just getting the services. Tell us about
How
the
that
whole
comes to be.
process. How can parents ask healthcare providers for referral to speech?
So they, with or without an autism diagnosis, when we have a delay in speech and language, a parent can ask at any time to their pediatrician, can I get a referral, or their primary care provider, can I get a referral to speech therapy? I would like my child's speech evaluated, is basically what you're asking for. Physicians are really good at collaborating and referring with speech pathologists. They understand the value of speech therapy as part of early intervention. Now, a physician is going to look at the milestones towards speech development differently than what a speech pathologist will do during that initial evaluation and assessment. Your physician is looking at gross milestones, right? Benchmarks. What speech pathologists will do is they will give standardized tests that are very specific to both the speech side of it and the language side of it. And we will generate reports that go into detail about the recommended interventions and the things that you may need. We may also be able to show that, well, this might be due to a hearing loss, or this might be due to something like childhood apraxia of speech, which is a motor planning issue. We're able to hone in on the etiology or the likely cause of why that speech and language is disrupted. So it's really important that you press. If you have a physician who's not willing, which isn't very often, they're pretty supportive usually, but you may say, I would just like an evaluation in order to really know for sure. And 9 times out of 10, if we are not meeting those milestones and the physician has documented that already, they are going to write that referral without a problem. And insurance typically covers that because it's considered a developmental delay.
So then for the parent to actually get the services, if I don't have money to go into the private sector, which is the great majority of us, because these kids become expensive. So do I actually need the evaluations to give it to the insurance, or just the primary care referral will suffice?
So there are a few different ways that we work with families around accessing services. I'm a founding co-director of a neurodevelopmental autism clinic that we established at Washington State University in the College of Medicine. And that was to train our future healthcare providers as well as meet a need in our state. Wait list was 10 to 24 months long, depending on your community. And our hope was to get that down a little bit. What we did is we would evaluate kids as a multidisciplinary team and give the diagnosis of autism. But the most important part was really helping them navigate the system and figure out where their services could be accessed. So the reason I bring that up is to say that a lot of families aren't aware that the school system is obligated to provide early intervention when there's been a diagnosis of a developmental delay, which can include autism or other speech language disorder. And what happens is you can reach out to your local school district and request an evaluation. This is funded through special education, so it sounds funny to say I need a special ed evaluation for my 3-year-old.
Yes.
However, it's just funded that way for speech therapy, physical therapy, occupational therapy, and also there's developmental preschool that kids can be eligible for, where you can take them every day and they go for 2.5, 3 hours, and the speech pathologist comes into that setting and works with them. So if you don't have all of the insurance benefits, you can also get it through the schools, or if you're placed on a wait list for a clinic, while you're on that wait list, you could access it through the schools. And so that doctor typically is the person that makes the referral, or your primary care provider, and then that speech pathologist would do that evaluation. authorization for insurance is typically required before they'll schedule your appointment. But again, that's why, depending on the needs of that family, when we think about families who are Medicaid eligible, meaning they're in a lower socioeconomic status, may help them find resources for those providers that take that Medicaid, because Medicaid has a lot of benefits available when there's an autism diagnosis, and we want you to be able to access that. So a lot of this is about knowledge and about education. And so we've taken it upon ourselves at WSU for us to actually train speech pathologists across the state around the benefits that are available. Because as advocates, we want to be sure that if we evaluate you for a speech language disorder, we're telling you all the available things that can come along with that treatment plan that you're entitled to based on your
Thank you.
special
Thank you.
circumstance.
That is very, because I mean, like a maze, you know where to go and it's all over the place. Yes.
And it varies state to state as well. So that's also an important thing to think about.
So then managing the wait times is very important also, because I emphasize this, that even if you do not have an actual diagnosis for autism, you're still eligible for speech therapy, right? Because
In
sometimes
most
you get
cases,
the
yes.
diagnosis it's a wait time, and that's a waste of time.
Yes.
So you don't need an actual diagnosis to actually get the speech therapy. Is that correct?
That's right. And it's really important. What we tell families is, well, we put it this way: speech pathologists are considered first for red flags for autism, because often we'll get a referral for speech therapy for a delayed talker, and we may be the person to notice those red flags first. And then we're going to work with the parent to say, go back to your pediatrician, and we see some characteristics of autism, maybe together we can, this. So you don't need an autism diagnosis to get speech therapy. If you are delayed in that area, a physician can make that referral with or without that autism diagnosis. And we are going to treat a lot of those needs the same, regardless, based on what we see and how your child presents. We're going to bring some of those interventions in anyway, and that child will benefit from that. So it's not so much labeling them to get that service, but it is important that we do diagnose if they do have autism, because it helps our understanding of how best your child functions. It helps the parent to have better awareness of what their are and how to navigate that. And so we don't want to ignore that diagnosis. But as you said, the wait list to get in for an autism evaluation can be very lengthy. And in the interim, we should still be trying to get into the therapies that would be needed.
That's wonderful. Thank you so much. So, of course, let's talk about, what if I just say, no, I mean, oh, he's like bilingual, it's okay, you're too exaggerated. I mean, tantrums, 2 years old. And, but there were tantrums that were just, I was just cutting the food, and he didn't like, wow, he was like that. And they said, well, no, you exaggerate, he's not your textbook. So sometimes in the family, they say that just overprotective, etc. So what are the risks of delaying the therapy? What are some potential and consequences of delaying that? Because sometimes we just wish it would go away.
Yeah, and that can be a bit for your child's potential and progress, because we do think that, well, they're just, as I said, sometimes we attribute it to personality characteristics or certain social expectations about child behavior. And so it might be, well, they're shy, or, well, we've had, a household recently, and this is why they're doing this. And you talked about the temper tantrums, and you're about the terrible twos, right? And there's a level of tantruming that is well beyond that. This is inconsolable. This is to do the daily things that I would be doing because this level of disruption is occurring. And that's how we help parents to understand the difference of what would typically be happening when there's emotional breakdown versus it could be autism. And it's really important. The consequences is that you have, as I mentioned, this critical window of time where a child really benefits in the most optimal way from those interventions that have been shown to work between the ages of 13 months and 5 years of age. It is important that if we are identifying you at 18, 24 months, you now have that full window of development where the brain is actively changing to benefit from that intervention. But if someone brings it up to me as a parent at 24 months and I wait, they're 4.5 before I finally get them into a therapy because life's become so difficult now, you now have only given that child a year of that optimal development for that intervention to really have an effect. Now, I want to be clear, intervention always has an effect, but the most optimal is during that early period of brain growth because the brain is rapidly changing so much. And we often will say, your child did not acquire these delays. They're not going to learn to suddenly talk just the same way they've been around people who are talking. It hasn't happened. So we are not going to expect that suddenly it will. You can never err on the side of working with that child and helping bolster that developmental process.
Yes, and it's very frustrating. Imagine, I mean, Rafael is 21 years old now. So when I just noticed that something was different, and the great majority, even doctors would say, no, I mean, you're going to have to wait. But I'm glad I insisted. But in reality, because of all those waits and because of not knowing what he would actually need, I would diagnosis until he was 5. But because I persisted, I started speech therapy when he was 4. So all the times that I did not know what actually, I mean, there was something wrong, but I had no idea what it was. And
right.
And with lack of resources and if you research. So then something that I would like to share also, I remember going in Canada, I went into a resource, and it's a very family oriented, and a family came that had just moved to Edmonton, California, Canada. And I noticed the child that was just there so calm, and I said, how you just keep her so still? Because my son will go all over the place, right?
Yeah.
We just don't listen to what they tell us. We do our own thing. And I was like, okay. We there's sometimes it's because we are ignorant, and it's not that we are ignoring the
Right.
symptoms, but we just don't know what they mean.
You
Or
don't know. Yeah.
you have the resources and you decide not to use them because you just want to that, right? So
That's right. Yeah. And in the past, before, if you're a first time parent, you really don't know what is typical. You've read the books, maybe you had some experience with young children, but when it's your own child, it's very different. And so you may not know that this is not typical behavior, and you've adapted your lifestyle to facilitate the needs of the child well beyond maybe what would typically be happening. And so we always say when you see kids together, that's an important part of the diagnostic process because you can look at that typical peer development to the child's needs and it really starts to stand out. And for parents, often that's why it's age 4 or 5, because it might be, well, once I enrolled them in preschool and saw them with other kids, and then the teachers started talking, or kindergarten, the teachers started talking. And so we know that in the United States, the average age of diagnosis is still 49 months. Even though we can identify autism to very skilled, trained people, we can see it as young as 12 to 13 months.
wow.
Our goal is really if we can get this diagnosis, the average age down to 18 to 24 months, that's really where we're going to get the most benefit from those interventions. The American Academy of Pediatrics recommends screening for autism at 18 and 24 months at those well child exams, regardless of a parent's concern. And so you may see your pediatrician asking you some questions because they're now looking for it, even if a parent doesn't have a concern. So know that it's in the best interest of your child if a physician does say, I'd like to make a referral for speech therapy or some other intervention, that it is never going to hurt your child. Get a sense of what those are, in a full evaluation by a speech pathologist, as I said, is very, very different than a 20-minute well-child visit with a physician saying you have, as an autism concern. It may be the beginning of a journey of a whole lot more of evaluation, and just be prepared for that. Because the more that you know, the you are as that parent.
Right. I mean, it's in prevention, and I mean, to help them give them therapy anyway. I mean, I remember asking my doctor, would not confirm, and I say, okay, what if this is not like I'm diagnosis as pain or a neck pain. I mean, these therapies are the same. So just do it, right?
That's right. We know that early intervention benefits all children. And so it is an opportunity for your child to get extra support if they are delayed in the acquisition of those skills. And then, as I said, sometimes we do discover more and we're able to help guide that. In many cases, people looking at their children who they suspect may have autism, or maybe they haven't noticed, a lot of times it looks like there's a hearing loss because they're not responding to their name, or they're not engaging with you in that way. And so we also know that if we don't evaluate the hearing, that's also a big part of this, because we want them benefiting from that therapy. And so it gets intricate, but people are very well trained in bringing all these pieces together. And what often you will find is that the speech pathologist is often at the center of helping put those puzzle pieces together, because they're looking at your development in that way: hearing, speech, language, and development. And what can happen is they can also suggest some other referrals that might be needed, that a physician might not make that same recommendation.
Right. So we had mentioned before about the parental support. But give us some tips, please. How can parents help support their children in the process and ensure consistent progress? Because
Yeah,
parents are key.
parents really are key. And we've all either heard the story or experienced ourselves the feeling of bringing a child into speech therapy and the challenges that can come with that when a child has autism, right? It's a new environment, it's unpredictable, it's different. And so sometimes what we see is sometimes the child may not separate from the parent in that process. And when I was teaching students at the university, we had the luxury of the observation window where we could let the parent watch the therapy in real time as it's happening and learn some of those techniques. And so sometimes what happens is you, as that parent, initially may be asked to leave that therapy room in order for us to kind of work these challenging behaviors, but start to build that rapport with your child. And that can be really overwhelming at first. That can feel funny. But one thing I want to say is that we absolutely do want you in the room all the time in the beginning as we're teaching these skills, once we have this rapport established. So it's a balance between, as I said, you're a team, the parent and the clinician, in making those decisions. So what can happen is your child may turn and run to you and just want to, sit up and won't work with the therapist at all. That's a scenario where we might say, hey, mom, step out for about 10 minutes. We'll do a few things. I'm going to have you come back in. And initially for that child, because this is the hardest thing they're ever going to learn to do, they haven't learned to talk yet because it's hard. And the things we're doing may make that hard for them. It'd be really easy to say, this isn't working. We're not coming back. And so I share these stories to say that speech therapy is fun. It's an engaging and incredibly rewarding therapy to engage in with your child. But if you run into those hurdles initially, know that those are very, very common. Autism and speech pathologists are so used to that. They're not judging you as a parent if your child, won't engage. Bad speech pathologist if your child won't engage. It's simply part of the process. And so give it that time that it needs in those first few sessions. And so the support to the parent is that we bring you in and we do this together. and we model those techniques, and we have you try them, and we may even have you functioning in the role of the clinician, because as we said, at the end of the day, you're going to be doing these things with your child. So it's really common for us to see parent, child, and clinician on the floor working together. And that's that support we're giving you is, it's okay. And if, I a session where there was a child that he was laying on the ground and he was coming in for an assessment and he was screaming and screaming, and the speech pathologist was in there with the parent and they were just trying to figure this out, and in for a moment, and we just grabbed a few things and the screaming stopped and he sat right up and he started engaging. And it was as if he just needed that time, right? And once children with autism have themselves, their sensory regulation is so worked up, we have to give it that time. We cannot cut right through the center of that and demand, coerce, or control. We need to give it that time. And so the look on mother's face was very devastating, right? She was feeling not successful that day and that this wasn't successful. But she sat on the other side. And the minute that it shifted, she's like, okay. And this happens all the time. This isn't just your child. This isn't just you. This is part of the process. And so that's a tricky part to work through, I think. And so trust with your speech pathologist is key for that support too.
I mean, some facilities have windows so that you can watch, but it is like you said, devastating is very nice word. I mean, have to say, guilty. We, because to overprotect, because I mean, there's this fragile. So I mean, the first that I went to the speech pathologist, and she had to be very, very firm. She had this really, really cool gadget that they would water, and it was like a well, those the water, and it would turn around, and he had to say water. And he just wanted to use it. And no, you have to say it. And I was like, and he would run to me, and he would, and she would, no, do it now. Very fair. You speak to my child like that, and so, I mean, I knew her. I mean, because I know you build the trust with the therapist. So she said, maybe I need some time just alone with him, and like me, I'll be there. I mean, what if he needs something? What if he, well,
Yeah.
not alone. So for the first time, I went outside to walk because it was just so overwhelming.
That's right.
To feel so helpless.
That's right.
I mean, I obviously walked and prayed and tried, because he needed me not to be there. And
that's right.
Very, very difficult.
It is. And I will, I kind of that where it was my very first experience with someone with autism in graduate school in my training. And those sessions were 50 minutes long, and the little boy was about 3 years old.
Wow.
And, he had a hard time with transitions and all of this. And it took a little while to build the rapport. And I had worked with him for about 7 months at this point. And when we would leave now, instead, he'd cry when it was time to leave, and he'd hold on to the door on the other side, crying because he associated it with these fun things.
And then I would get very jealous, why don't he doesn't be anymore?
And so, I found that card that parent wrote about the impact of working with him and having that be something that really made that difference. And so, you're right. But there is that shared empathy and compassion and emotional piece that you're doing together on behalf of that child.
Right. And I mean, start, but most people don't finish. So I think the consistency and persistency is key.
That's right.
Before we close this, I want to thank you on behalf of all the community from all the parents that maybe at some point have been benefited directly or indirectly with all of your work, for all of the medical community that you're still impacting, because what you do and all your students that you have also trained, you are giving people their voice. You are giving our children a voice. And that is just precious. If not just communicate what they feel, they will learn that I want to thank you for how impactful your work has been. Really, thank you. So, is there any additional advice that you would like to tell us?
Well, one thing I would say is that there are a number of resources available to families, and I think it's important. We've talked before about how it can be very overwhelming to plug in autism and intervention into the internet and just figure out what what's that. And so I'd like to share a few resources that could be really helpful for families.
Please, yes.
And the first is, and these links will come up at the end of our interview together, but the American Speech Language Hearing Association has an excellent resource that outlines the typical communication and language and speech milestones that you can expect from 1 month up to 5 years. And it's outlined so that you can kind of see my child relative to what should be happening.
Okay.
They also have a resource to help you find a speech pathologist in your community. There are over 171,000 certified speech pathologists in the United States.
Wonderful.
Depending on your area, if you're rural, it may be a little harder to access this. And so they put together a resource. You plug in your state, your county, and where your location is, and you will get a list of those certified, clinically competent speech pathologists. Another resource is Autism Speaks, and that's a huge advocacy organization that really is grassroots driven from families of children with autism, and it provides good information about the early signs of autism, what you may be seeing that may be red flags for autism, but it also provides resources throughout the lifespan. And so it's helpful to look at, especially if you're seeing some things and you've got that whispering voice in your ear about, is this autism, is it not? And you can look at those early signs are. And then last, I would say, never be afraid to ask, right? This is not, you've said it before, autism diagnosis is not a prognosis. Autism diagnosis doesn't determine your child's outcome. What it does is it helps you understand how they learn best, and it helps you understand how to help them reach their full potential and who they are as a person. And so it's not about the label or the quantity of that intervention, it's about the quality of that intervention. And so don't be afraid to ask your physician for a referral for speech therapy, and don't be afraid to broach the conversation about their development if you think there are things going on here. A lot of times, and I've said this before, 90% of the time the parent is right.
Our intuition, we have parents and we
So often what happens is we hear the story, I've been saying, my physician didn't listen to me and I knew something was wrong, right? And I will say we have gotten so much better. When those new guidelines came around for screening at 18 and 24 months, physicians aren't ignoring things. But we do know that if you're hesitant to broach that conversation, they may not bring it up unless it's so significantly impacting their development. And so it's important that for all kids, even if it's subtle, we still ask the question if we need to.
Right. I mean, it doesn't. The most important is better to exaggerate than to say I should have.
That's right. And that's the purpose of those evaluations. And what will happen is a speech pathologist will write up a full evaluation around your language development and communication and speech acquisition. And they will say, here's a report to take back to your pediatrician. Your pediatrician makes the diagnosis if there is autism present. Your speech pathologist can administer tests that help that person to understand where that fits in terms of the diagnostic criteria.
Yeah, well, it is important. And I mean, fortunately, just of the actual diagnosis, but today at least is not a bad word anymore. And people are more and more aware of the symptoms and the fact that I mean, it's part of. So
it absolutely is. And the beauty of the neurodiversity in autism, the talents and gifts are the things that we're really looking for. This isn't to cure it, as you said, this isn't something that needs to change who they are. It's to help them be the most that they can be.
And also for the parents, it's if a child has a voice, but I cannot understand it, then I need to also learn how to understand.
Absolutely.
So
Yes.
learn to communicate with him and all things. Wow. Well, I hope that this is the first of many. I mean, we just pick your brain really with all your experience and all your stories of success. We need that there is hope because,
Yes.
The majority, we are just so afraid. And when we listen to those stories of success and the fact that my child, he was not speaking, today he's singing.
That's
And
right.
he's
That's
playing
right.
the guitar and
Yes.
he sings rather well. So, it
It's
just,
amazing.
so what he's singing, he couldn't speak. There we go. So we never know until we just should never say I should have. So we will have you again, right?
I sure hope so. I've
Yes.
really enjoyed the conversation today and also the support that you're offering parents through this resource is so valuable. And I think the real world context for this and the conversations are really helpful for parents to get that lens a different way, as opposed to looking up information, as you said,
Which is
hearing the
overwhelming.
conversations. Yes,
You get the
it's so
information.
much more relevant. Yes.
Yes, so really, really well, thank you. I have to close this, but from the bottom of my heart, thank you ever so much.
Sylvia, it's been a pleasure.
Thank you. Wow, that was a lot of information, right? I know it can be overwhelming, but that's the idea. We need to have the right questions so we can have the right answers. And the fact is that even if our children do not speak, they do have a voice. That's very important. And we oftentimes need to help them to get their, until they're able to get their own intelligible voice, right? So tell us, how did you feel about this? I'm glad that you were here. And well, as you know, please share this if you want to, and tell other people that these resources are available. And most important, remember, you are not alone. And we're here to help you become unoverwhelmed. God loves you. See you the next time.